Thank you for joining us today. This is our session on public safety, and we're thrilled to have with us Deputy Fire Chief Daryl Donato from the town of Palm Beach. He's going to be sharing a lot of his kind of views and perspectives related to the implementation of medical marijuana, not only the amendment that's just recently passed, but also what they've seen in terms of preparation as the statute that's been in place now for about 2 years. And with that, I'll turn it over to Deputy Chief.
Thank you very much, Holly, for allowing this opportunity to just share a perspective from the fire service on medical marijuana and its impact on public safety agencies. Fortunately for us, there are 26 other states that have already done this. And that gives us some background with which we can evaluate the potential impacts and some lessons that have already been learned by other public safety organizations and fire rescue organizations in the country. Florida laws require that medical marijuana be grown indoors. And so that in itself creates some specific challenges and hazards. Indoor facilities for growing medical marijuana are going to have very complex equipment and machinery used to manage fumigation, CO2 enrichment, high intensity lighting, large volume humidity control, large fans, oil extraction, and the like. There'll also be chemicals and fertilizers and pesticides that will all be stored on site and used in these enclosed spaces. And what we've learned is across the country, there have already been a number of fires, explosions, and code violations and other mishaps related to the indoor growing of medical marijuana or marijuana. Florida has a limited number of these facilities. And these facilities are sure to be very large and very complex industrial settings, not just a simple agricultural operation as some might suppose. Really specific hazards, such as CO2 used for enrichment and fumigation systems that may involve sulfur burners creating sulfur dioxide. Sulfur dioxide, when coming in contact with the moist layers of a person's lungs, can produce sulfuric acid and cause severe burns to the respiratory tract. Those are real common things that are used in these growing and processing type operations and present very, very unique hazards and challenges to the fire service. And just from a community standpoint, these plants are going to generally emit large amounts of odors that are often offensive to neighbors, but what happens from a fire service perspective is you begin to get these 911 calls for this unknown odor, and in most cases that odor is just a byproduct or an off-gassing from these plants, and so those things may create calls and issues for the fire service. Amendment 2, when it was passed, specifically preempts regulations to the state. Although there is some language in there that we need to pay attention to and that we need to build into the way we address this in our communities. It says that a municipality may determine by ordinance the criteria for the number and location of, and this is the important part from a fire service perspective, and other permitting requirements that do not conflict with state law or department rule for dispensing facilities or dispensing organizations located within its municipal boundaries. And so I would urge municipalities to be very specific in their permitting requirements so that facilities that are within their municipal boundaries must comply with local fire codes and local building codes, and that they address the requirements of the fire service in terms of safety for both those occupants that may be there, the people surrounding those facilities, and the first responders that will have to enter them in the case of an emergency. There's specific things that the fire service may need, diagrams showing where chemicals and industrial operations that present hazards are located. Also, marking of these facilities so that first responders arriving on scene know exactly what chemicals are being stored and where. The Denver Fire Department, and as everyone knows, the state of Denver has, or state of Colorado has had, marijuana authorization for some time. And the Denver Fire Department has developed a policy that's available online for anybody to look up. And it's very comprehensive. And I would suggest that it's a very good starting point for municipalities to look at in terms of specific permitting requirements related to fire and life safety in their areas. Just apart from the general policies, there are international building code or Florida building code, and growing facilities are classified generally as an F1 occupancy, which is a moderate hazard area. There are requirements for firewall separations. There are requirements for protection systems in there. There are requirements for electrical code because of this high-intensity lighting, special electrical code issues. But one thing I would urge folks that have these growing facilities in their areas is to be very concerned about the way these facilities are segregated. Seldom will growers grow marijuana in one large room. Instead, they grow it in multiple rooms because they have a bunch of plants at various stages of growth. And this means that you have to pay very, very special attention to the proper exiting requirements. These smaller rooms can often form just a big giant maze and present very significant challenges to first responders who might be going into these facilities to deal with emergencies. Likewise, these facilities are required to have very high security measures to keep people out. The problem is those security measures may inhibit first responders from getting access quickly to them. And worse yet, those security measures could trap people inside. And so those are very specific concerns and related to the growing facilities that the fire service is concerned about and needs to pay close attention to. Growing is just one part of this. Processing the plants that are grown is probably the most concerning part to the fire service. Processing is used to increase the concentration or obtain the oil from medical marijuana plants, and it often involves the use of hazardous materials. And these operations, these processing operations, should draw very, very close scrutiny of building and fire code officials. Extraction using butane is the most cost-effective method, but it's also the most dangerous method out there. And depending upon the quality of the butane used, it may cause the entire facility to be classified as a high hazard occupancy. CO2 extraction is another method. And although CO2 doesn't really present a risk of explosion, it's much safer, it's an inert gas, it does present a significant risk of asphyxiation. And then there's also alcohol distillation, which is another method of extraction used in processing. And in that process, marijuana is soaked in alcohol, and then the liquid is boiled off. And this is an extremely dangerous process. And so all of those processing methods present very unique hazards to the occupants, the surrounding community, and the first responders. And it's something that fire service officials need to pay extremely close attention to. They need to be intimately involved in these process developments where they're being put in, so they can understand them, so that they can help control any risk that may be there. They can protect the surrounding community, and they can also protect the first responders who are going into these facilities. So once they've grown this medical marijuana and once they've processed it into a usable form, generally then it's transported to dispensing facilities, where these facilities are the place where most likely to encounter this. Right now, I believe, as of January of 2017, there's only 7 of these growing facilities in the state, and there's allotment, I think, for 8 of them. So there won't be many of those, and so it's unlikely that we'll have a lot of interaction with those. But where we expect to see the most interaction is in the dispensing facilities, and there the specific hazards to fire rescue or first responders are more limited. Primarily, the concerns with dispensing facilities relate around access and egress limitations that are imposed by security. These facilities are required to have a significant amount of security. They're required to have locked rooms or vaults and areas that are off limits, and they're required to have people on site for 24 hours a day. And so for first responders, our concern is, are we going to be able to get in and provide the the necessary protection that we need to provide or access people that might be involved in a medical emergency? Can we get in quickly? And then also, depending on those security measures, whether or not people that are inside are going to be able to exit or egress these facilities quickly and under all conditions. And so while there's not a lot of hazard in these facilities, there is this potential for ingress and egress limitations, and fire marshals should be very, very careful to review those security measures and ensure that people that are inside can get out when necessary and that first responders can get in when necessary. For the fire service, we also have some concerns, at least I do, about employment or labor-related issues. Amendment 2 provides some guidance, but not much to employers. It says that there is no requirement for any accommodation of on-site medical marijuana use in places of employment. And therefore, in my opinion, as an employer, we're going to prohibit employees from using medical marijuana in the workplace specifically. We're going to include that language within our rules. Similarly, Amendment 2 prohibits the operation of vehicles while under the influence of medical marijuana. And in the fire service, we operate lots of big vehicles that go very fast. And we also operate a lot of complex machinery and equipment on fire scenes and even during medical emergencies. And we're going to specifically prohibit any employee from driving or otherwise being under the influence of medical marijuana while on company time. And I would urge others to adopt specific rules that specifically prohibit smoking, ingestion, consumption, or being under the influence of low THC cannabis or medical cannabis in the workplace. And some folks, may feel that there's some reason for a reasonable accommodation, and I think you're going to hear more about this from an attorney, and I'm not an attorney, but marijuana is still illegal under applicable federal laws, and so the guidance that we've been given is that we're to and we want to enforce our zero drug tolerance policies, and to be proactive rather than reactive. We're going to specifically include language within our drug-free workplace rules and other places in our rules that prohibit its use or its people from being under the influence while at work. Public safety positions can't risk allowing folks that are impaired to be out there caring for others or doing complex operations while impaired. And so, for us, we think that's a very important part. And finally, for us, we've been thinking about the community-related impacts. And, one of those things is with the general increased use of marijuana in the state and the higher costs of attaining medical marijuana, we expect that others are going to be seeking ways to profit through their own cultivation, processing, and dispensing illegally and without a license. And so there's a lot of concern about home drug labs popping up that will process medical or process marijuana into similar high concentration or other forms. One of the things that's happened is people are using this butane processing in homes, and they're producing what's called butane hash oil, and they're doing this within residential occupancies. They call it blasting. I think that's the street term for it. It's very profitable, but it's extremely dangerous. Colorado's experienced this, and in the first year that Colorado legalized marijuana, they had 32 of these blasting explosions in residential occupancies. And so this presents a significant hazard in our communities that we're worried about, and we're also worried about first responders that are being called to homes for one reason or another, be it an odor or an unusual issue, and encountering these very, very high-risk drug labs. And, lastly, we're kind of thinking about how we can assess the impact of this in our communities. And we're not sure if there's a good way to do that, but from an EMS provider perspective, we do medical reports on every patient we encounter, and that information related to a specific patient is protected and under the HIPAA laws, and both the state and at federal level. There is a way for EMS providers to capture within the medical history of a patient encounters whether or not somebody is taking medical marijuana or is a medical marijuana patient under their medical history. And there's a way for EMS providers in general to usually go back and assess how many of those encounters you've had and whether those encounters might have been related to some type of accident versus a medical call. And so, if you find that you have a large number of motor vehicle accidents with patients that have been prescribed medical marijuana, that's one way for us to begin to assess whether or not this is having an impact on our communities. And that's just an exploratory thing because we just don't know. There are way too many unknowns. While other states have allowed its use, here in Florida, we don't have that experience yet, and we're all concerned from a public safety perspective on what these impacts are going to be to our communities and our municipalities, whether or not the hazardous materials aspects will present significant challenges to our communities, whether or not our first responders are going to be presented with these dangerous threats of entering in these facilities, whether or not we're going to encounter problems in our organizations with the employee usage, and whether or not these things are going to pop up in illegal forms in our communities because of the increased demand and what challenges those might present. So that's just my public safety fire rescue perspective on the medical marijuana being authorized in the state of Florida. I think we're going to learn a lot more in the future, and hopefully we'll get a lot better at mitigating any of these hazards and protecting the people in our communities and protecting our first responders from these threats.
Thank you so much, Deputy Chief Daryl Donato from the town of Palm Beach. I know that several of our listeners, whether they have joined via social media or our resource portal, probably have a lot of questions, and we look forward to hosting you at our live Q&A on February 3rd.
I'm looking forward to it, and again, Holly, thank you very much for allowing me to share my perspective and hopefully help other communities prepare for this impact that's coming for sure.